Sbarisaka was smoking cigarette. I would see him, and then obviously I see lady Stompy on the floor or go ashtray. I will also take Stompinyana. It looked cool. Fortunately for me, my first pull a cigarette after I was light, sanang Joe, some inside the flames. Like, about this the same time, I lied on the floor for about a minute to two. Hakitsua, that was like, undizzy.
Katlehong community activist Tshweu Mosedi used to think smoking was cool. Now he spends his days teaching young people not to copy adults or to get sucked in by their peers.
And that's how it starts, and then on and on and on. And because it's nicotine which is addictive, then young people just like that.
His way of helping out is to get young people off the streets where they pick up bad habits and into this local community garden where they can be more productive.
We do have like spinach, carrots, cabbage, and they are working so hard.
But even so, devices like e-cigarettes are becoming popular among the East Rand youth. Mosedi says parents don't understand the health risks of vaping, especially because vaping campaigns mostly target youngsters, and e-cigarettes are seen as a luxury item.
Here's the problem about vapes. Like they are mostly bought by people who are working, who can afford them. They buy them for all family members. Christmas, baraka the gifts, the vapes. The kids mabai town, they are going to cry to their mama to sing and because now parents know they want to please their kids and they are less informed about the harmful effects of these devices, they actually buy them.
As the Gauteng coordinator of the South African Tobacco-Free Youth Forum, Mosedi has also been vocal about the country's proposed new tobacco bill. He's even attended public hearings. If passed, the bill will enforce the same rules for e-cigarettes and traditional ones. Mosedi says some who go to these hearings have a clear pro-tobacco agenda, as if they've been coached.
The things they are saying are lies. Some of them are even reading from scripts or from their phones, and they cannot even read what they have written on. We are not saying tobacco should be banned or produced. Let's just get rid of the cigarettes, we put them away from our children. But exposure to them and advertising and promotion, putting these products next to our kids, they will see them and they will want to taste. Hence they make them so colorful because they know who they're going to attract.
Young people, Mosedi believes, can't be protected from tobacco and nicotine if smoking isn't banned in and outdoors.
So public places, the parks, those are our spaces. Even our health facilities, we have clinics that have kuma background, kuna space, kuchwa abo nurse na abo doctor bayopem. Nonsense. We know the dangers of nicotine, we know what it does. And we also understand that smoking is a pathway or a gateway into young people using drugs and getting addicted. We know they end up being criminals or they die from overdosing substances.
Mosedi believes that despite obvious industry tactics to undermine the bill, it's up to communities to protect young people.
It's one of the only ways we can win the fight against substance and drug abuse, by being involved, everyone from government, not only complaining, pointing fingers, rejecting people. That's the role of the community. Unfortunately, the industry doesn't care. Us who can care, let's play our role.